Okay, so our next speaker, Ben, is the founder and COO of Engage, a business focused on helping older adults discover life-enhancing technologies. He and his team spent over a year interacting with thousands of seniors about what is most important to them in their health. Then they created a platform that informs, connects, and supports people with lifestyle-enabling products and services. Prior to Engage, Ben worked as a senior analyst in the alternative investment industry for over 8 years, most recently at Passport Capital. Help me welcome Ben.
Got it. Thank you very much. Nice to see you all this evening. As he said, my name is Ben, and I started a company called Engage. And the way we started Engage is we went into people's homes, and we did what are called CAPS assessments. CAPS is a designation given by the National Association of Home Builders. It's a certified aging-in-place specialist. And so we'd go in and look through somebody's home and then make a number of recommendations that ranged from physical modifications, putting grab bars in people's bathrooms, to introducing tech products or tech services, things like in-home delivery of food or drugs and things like that. And I conducted a number of these and learned a lot about them. And so what we're going to talk about today is aging in place and where technology can help the boomer generation as it gets older stay in their homes, and where it falls short and some of the problems around that. So what we're going to cover, starting with what is aging in place and what are the things that are needed to achieve it, or at least to make it more likely. What are the reasons why more people are going to stay in their homes as they age? What Silicon Valley is doing to help with this process, and where in some cases they're missing the mark. And what's already out there, and what's preventing the adoption of what's already out there. So aging in place. Aging in place, the CDC defines as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. The comfort piece is certainly a big part of that. I went into a lot of people's homes who were at times in their 90s, and they might have been aging in place, but not very successfully. You know, they were kind of at a stage where they were more shut into their own home than anything else. And so to help enable people staying in their homes, I think there's 3 categories that you have to think about. And one is home modifications. Home modifications are not something you can do with technology, but they're important. And why they're important is because falls are a huge risk for older people. 1 in 3 people over the age of 65 fall down every year. 20% of those people go to the hospital. The average hospital bill with rehab and everything else that goes along with that is $40,000. It's lots of pain, lots of suffering for the person, for their family, friends, etc. And that number goes to 1 in 2 after people turn 80. The maybe silver lining to some of that is 80% of falls that happen in somebody's house happen in the bathroom. And there are some very easy ways to mitigate these falls. You can put grab bars around a toilet and around a shower. You can put a non-slip surface at the base of a tub. You can put an auto on-off light switch so that if somebody's running to the bathroom in the middle of the night, they have light and are at less risk of falling down. Connectivity. By connectivity, I kind of use this term quite broadly. So connectivity for me covers everything from kind of connection to basic goods, so food and healthcare system, to kind of those higher up the Maslow's hierarchy of needs sort of things. So connection to community, to family, staying in touch and staying intellectually engaged. Although there's less kind of empirical evidence supporting the importance of that, there's lots of studies out there that at least loosely make the connection between connectivity to community and to family, and lower incidences of Alzheimer's, of certainly depression, of high blood pressure, and some studies have even suggested that people live longer. And then the last is health and wellness technologies. So this by this, I mean the ability to monitor health metrics and access the healthcare system, hopefully utilizing those metrics to access healthcare before an acute event and not after an acute event. And this is a really important part of aging in place, especially for the boomer generation, because it's a generation that is not very healthy. 2/3 of boomers are overweight or obese. 50% of them are taking a heart medication, and 20% of them have diabetes. So this is a group that is not going to enter old age in a great position in terms of health. So let's turn to some of the pressures that are going to keep people in their homes for reasons that are necessary and for reasons that they want as well. So first, we have a huge demographic transition going on in this country. Many of you probably know, but there's about 46 million people over the age of 65 in America today. It's going to be 76 million people by 2030. And most of those people have not saved adequately for retirement. So the average person between 55 and 65 years old today has retirement savings of $136,000. That translates into about $9,000 of income over the rest of their life. And that, especially for those of us who live around here, but that anywhere in America doesn't cut it. And it certainly doesn't cut it in terms of providing institutional care like assisted living, because the average assisted living facility in the United States costs 4x what somebody spends to stay in their home, and no, Medicare won't cover any cost of long-term care. Only long-term care insurance will do that, and long-term care insurance only is owned by about 10% of the senior community currently. And so what does that mean? Well, what that means is already started to play out. So there is already 70 million people in America who act as caregivers for neighbors, friends, family, loved ones, and that is going to grow as our demography gets older. So the good part about that is boomers don't want to go anywhere. Boomers want to stay in their home no matter what. So the AARP did a study, and they found that 90% of people over 50 said staying in their home was a top priority for them. They found that 50% thought that losing their independence was the scariest thing that could possibly happen above death, disfigurement, or anything else. So even though there's this group of people that is unlikely to be able to leave their homes, the good part is they want to stay in their homes. So at least everybody's kind of aligned that way. And so, we come to this point where the stage is set, right? On the one hand, there's lots of cost pressures that are going to keep people in their home. On the other hand, people want to stay in their home. And so what are people doing to get ready? And the answer is very little. So that it's a little confusing, right? Because anybody in the baby boomer generation either is participating in the care of their parents now, or will be soon, or has been already. And so they've seen some of the issues around problems encountered with facilities or elder abuse, and they have felt put upon and burdened. And so they're coming away from this saying, I want to stay in my home, and I don't want to be a burden on my kids, but nobody wants to do anything proactively. And so I think some of this is just the nature of human beings. The reason why boomer retirement savings looks not great, some of it is what happened in '08, but some of it is that people were not necessarily very proactive. And I think this is similar, but on top of that, nobody wants to be stigmatized as old. So when I started doing home visits, I was in the home of a gentleman, very nice guy. He's 95, and we were sitting in his living room, and it would take him a few times to kind of bounce out of the couch or the chair he was sitting in onto his walker. And there were moments of terror where, I thought this man's going to fall down in front of me. And we're talking about ways that he might modify his home to make it a little safer for him. And he happened to have a rug on top of the carpeting, a shag rug that was probably this big. And like I said, this is a guy that can't get off the couch. And I said, sir, we're going to talk about grab bars, we're going to talk about stair lifts, we're going to talk about a lot of stuff. But let's first talk, this rug is a real tripping hazard for you, for me, for anybody who walks into your house. Let's talk about picking it up. And he looked at me and he said, son, the thing you're not taking into account here is I'm spry as a cat. I'm never going to trip over that rug, and that is not a problem that I'm worried about. And going into people's homes, I found this over and over again. People in their 70s said, that's important, I like what you're doing. And I have a neighbor, he's in his 80s, you should go talk to him. And I'd go talk to him, and he'd send me to the 90-year-old neighbor. And on we went. So this is a big problem that, acting proactively is tough in the first place, but if you feel like you're going to be called old, you're definitely not going to do it. So in walks Silicon Valley, our home and the hub of global innovation, and they say, we're going to figure this out. We're disrupting all sorts of industries and we're solving all sorts of problems. So no problem. And so you have a group of people in their 20s and in their 30s, and they read all the same literature as I've read. And so they see this demographic transition and they understand the problems that people are going to encounter. And so you have a bunch of these people create new devices. And so they create these technologies and they're exciting. One of them maybe is a passive monitoring system. So this is a system, and there's several of these on the market now, where you could put a tab under somebody's bed, for instance, and it would create a baseline of activity. And every day, mom gets up at 8 in the morning, and then one day she's not up and it's 10, and adult child who lives across the country would get a text message saying, hey, maybe you should give your mom a call. And this is great. If she's had a stroke or if she's fallen down or if something's happened, here is a great way to solve that problem. And so there's lots of people that are supportive of all of this innovation. You talk to doctors, you talk to healthcare systems, talk to insurance companies, you talk to home care agencies. All these people are invested in keeping people in their homes, and they say, you're doing great work, this is brilliant, and here's a bunch of VC money, go out and go push this to everybody. And so I sponsored a tech fair at Avenidas. Avenidas is a senior center here in Palo Alto in January. And one of the speakers, there's probably 200 people in the room, and one of the speakers, and everybody more or less was over the age of 65, and one of the speakers said, okay, show of hands, how many people in this room have a personal emergency response system? 4 people raised their hands out of a room of probably 200. Okay, how many people have any sort of home monitoring system, be it one like I described, or a drop cam in a house, or even a smart pill box that'll show somebody else if you took your medications? 0 hands. So this innovation wave from Silicon Valley, these people have talked to all the experts, gotten all the support, but they never talked to the people who are actually going to have to adopt their products. And because of that, they're kind of missing these people and their target group in the night. And in some ways, I think that's understandable. Because when you think about the people innovating and creating new technologies, a lot of them are quite young. The average age of the Google employee is 29. And so that 29-year-old, and even maybe his elder managers, they don't seem to understand the difference between the boomer generation and the greatest or the silent generation. And you see it in what they say and what they do. So here's for instance, Chris Urmson is the technical director of Google's self-driving car project, very smart guy. And he recently said, when you think about the baby boomer generation, they're starting to get to a point where they feel uncomfortable driving, or their family feels uncomfortable driving, or their family feels uncomfortable about them driving. And so he's saying, hey, look, I'm inventing driverless cars, and isn't this great because this is going to take care of all these problems. What he might have missed is the oldest baby boomer turned 70 this year, and the average person who gave up their keys was in their mid-80s. So he's off by about 15 years, and in fact, the age of people buying cars in this country is going up. The average age last year was 55 to 64 was the biggest demographic buying cars. Previously, it's been 35 to 44. So there's, again, this kind of disconnect. And then that gets exasperated when you talk to older adults and you ask them how they see themselves. So Del Webb, who is a home builder, and they built a bunch of age-restricted communities in Arizona, the Sun City communities that some of you might be familiar with, they did a survey, and the average age of the participants in their survey was 73. And so they asked this group of people, what age do you identify the words elderly or older adult with? And they said 86. And then they asked them, okay, what age do you most closely identify with? And they said 53. So you have this 33-year gap in what they think is old and where they're identifying. And this is the group of people who thinks that they're in their early 50s and they're getting marketed to like they're in their 80s. So that's not working. The reality is that boomers are a lot more savvy or are adopting technology anyway much more quickly than the people creating the technology seem to understand, which I find odd, but here we are. So here's some of the problem, and some of it is in the statistics. So over 60% of boomers have a smartphone, but some of that is tough to see and tough to find because of how we talk about older adults, and this is probably symptomatic of our culture and how we treat older adults in this country. But most of the time we talk about older adults as 65 plus or 55 plus. And we never talk about younger demographics that way. We always say 26 to 30 or 31 to 35. But this group gets lumped all together, which seems quite odd given the difference from the average 65-year-old to the average 98-year-old is probably quite large, and maybe somebody should be paying attention to that. So the reality is lots of boomers have smartphones, and more every year. Even the 27% of over 65-year-olds who have smartphones, that is growing at 8 to 10 percentage points a year. So even the older demographics are getting technology, and certainly the boomers, the oldest boomer, 70, they're adopting it quite quickly. They're also not just adopting technology, they're using it. So 1 in 4 boomers is shopping via mobile device. This isn't just online, but with a tablet or with a smartphone. And about half of people over 50 have a Facebook account. So we got the devices and shopping and on social media, but there's a problem. And the problem is that they have all these things, but maybe don't know how to use them very well. And I'll use my mom as an example. My mother is a very smart woman. She's a family lawyer and a clinical psychologist, and she's very smart. She's a Jewish mother, and we can leave it at that. But she is in her mid-60s, and she would slap me if she heard me telling you that, so please don't tell her. But I think she's representative, and so she has an iPhone and she has an iPad, and she can call and she can write really, really long text messages to me and my siblings. And that's great, and she can shop, and that's great too. But if she wants to do something else, and that requires maybe downloading an app, then she hits into all these problems, right? And so her Apple account isn't set up, or she forgot her password, or she knows her password, but she's trying to type it in on the really little screen on the phone, and the dots are coming up after she puts in the letter, and so she can't get in, and then she's locked out of her account. Or maybe that happened, and so my brother joined her to his account because he didn't want to deal with it, and maybe she got through all these things, and then she got this new app, right? Maybe she got Uber, And so she's got Uber on her phone now, and it asks her all these questions. And so it says, put in your credit card. And she says, well, I don't know if I should put in my credit card. And then it says, do you want to allow the phone to share your location with Uber? And she says, I don't know. So then she erases the app, and it doesn't happen. And so those things I think of as kind of frustration speed bumps. And you watch people hit them, and it goes from like, this is annoying, to I hate this thing, and they're throwing it on the ground really fast. And the more kind of, I don't know what the right word is, but some of these people just leave it at that. Others of them go and try to get help. And so they go to the Apple store, and they go to the Genius Bar, and there's the 25-year-old Apple genius, and he's going like this. Oh God, I hope Bill gets that one. And so, but he ends up having to deal. Sorry, it's not as data driven. I thought we'd keep it a little lighter. So whichever genius ends up having to deal with my mom, who's noticed that he's trying not to look at her, so she's really angry now. He doesn't want to deal with her at all. So he says, what's the problem? Great, give me your phone. Here you go. And then my mom wants to download a different app. She has no idea how. And if she goes to the classes at the Apple store, it's loud. She has to sit in a stool that's about this high with no back. And none of the experience is very comfortable. So what does she do? She calls my brother, or even better, she corners him around holiday time and gets him to deal with all the problems. And he does the same thing that the Apple genius does, right? He grabs the phone out of her hand and says, here, or he says, please don't call me, I'm stressed too, and can't we deal with this later? So that's unfortunate. And the reason that's unfortunate is because there are a lot of things that already exist that solve these problems of aging in place without inventing anything new. So some of these 20 and 30 somethings who live around here, instead of developing PERS or developing passive monitoring systems, they developed tech-enabled services. And so let's kind of talk through some of these things back to our three categories and what is out there and what could really help people stay in their home. So home modifications, again, that's not something that can be solved by tech. It's not something that people are doing in great quantity, but you can put towel racks that are supported that don't look institutional in your bathroom, and you could really change a lot of outcomes. So it's something that I encourage people to do, but recognize that, hey, people don't want to be proactive and they don't want to do something that stigmatizes them as old. Connectivity, on the other hand, is very different. We already have all these solutions. So let's think about this in the scenario that somebody is not able to drive anymore. So they lose access to all sorts of stuff. They first lose access to how they're used to getting basic goods, right? You can't go to the grocery store, can't go to your favorite restaurant, can't go to the doctor, you can't do any of that stuff. So all of those problems are already solved, right? So we have grocery delivery. Around here, there's 20 different food service deliveries. You want healthy food, we got 10 of those. You want not healthy food, we got 2 of those. In other parts of the country, it's probably the other way around. But you want expensive things, you want a meal kit, whatever, that's already there. And certainly, to get back to kind of the financial tension embedded here, not everybody can order Blue Apron every night. But Safeway.com has a nominal delivery fee, and when you take into account gas and the fact that you might buy a pack of gum at the counter, then that's knocked out the delivery fee. And when you think about that versus not eating healthy, not taking care of yourself, or getting pushed for other reasons into an institution or needing a caregiver, those costs don't line up. Similarly, drug delivery, my company Engage is partnered with a group called PillPack here. They're a virtual pharmacy. They'll deliver over-the-counter and prescription drugs to your door. They'll be proactive about refilling medications. And when we think about rides, same thing, rides to the doctors, rides to see your friends or go to your bridge group or go to your astronomy group or whatever it might be. Those are already here, right? We have Uber, we have Lyft. We have Lyft Hero. Somebody will walk to your door and help you to the car. And so again, this is something that is more expensive than Safeway.com, but we can't look at the price in a bubble. So first of all, and I worked out some math here, but if you took an Uber ride in the city of San Francisco, where they're quite expensive relative to other parts of the country, you took one every day, 365 days a year, and you went 5 miles and it took 10 minutes, it all in would cost you about $3,500. So if you have a car and you're utilizing it all the time, maybe that doesn't match up. And maybe you're using Uber more, or maybe you're using it less. But when you hit that late 70s, 80s, and you think about where the insurance premiums go, this is not such an expensive service. And at the same time, we can't think of it in a bubble. So, we talked about those 70 million caregivers today. The caregiver ratio today, the number of people ready to administer care, available to do that, versus the number of people needing care, is 7 to 1. As we have this demographic explosion, that number is going to go to 4 to 1. And these people are really important because they're all that the person they're caring for has. And so they need to be there because, like I said, some things technology can't solve. So taking a bath, getting out of bed, getting dressed, these things got to have a human touch. And the higher needs, companionship and having somebody to talk to, again, that's a human touch thing. But we don't want or shouldn't have our caregivers leaving work for 3 hours to drive dad to the doctor's office. If they're making $10 an hour, $20 an hour, and it's going to cost $30 to $60 for them to go do this, and they're going to miss work, and their boss is going to be mad, the Uber ride's going to be less expensive than that. And so, I think thinking, again, nobody wants to think proactively, but if you end up getting to a point where you need institutional care, it's ridiculously expensive. If you spend a little money on health and other things earlier, it doesn't have to be. And so that takes us to the health and wellness technologies piece. And those solutions are out there and they're getting better really fast. So one of the things I learned, I've gone to a number of tech fairs, health fairs, all that sort of thing. Nobody wants a personal emergency response system, but one of the things that I like to do at my booths is raffle off Fitbits. And one of the things I've observed anecdotally is people love Fitbits. And so many people have come up to me and said, I'll enter your raffle, but I already have a Fitbit and I am getting my 10,000 steps in every day. Well, that's great because I don't know how many of you have iPhones, but if you've looked on the health app, it is set up to record a ton of information. And it'll pull that in from your Fitbit or from anything else. And when I say a ton of information, I mean blood pressure, breathing rate, sleeping, activities, eating habits, and all sorts of other bodily functions. And these are there's already apps that link all of this stuff in. And so if someone was able to use the phone interface to download the correct app, instead of buying all of these new things and then hanging mom like she's a Christmas tree with all these ornaments of here, this will monitor this and this will monitor that, we already have the form factor to do it. And what's going to happen over the next many years is these apps are going to get better. They're going to collect more information, and that information is going to tell doctors more about how they can help their patients. And that's going to be great for the people that are able to treat acute events quickly or preferably avoid acute events altogether. So where does that leave us? Well, change is hard. So the adoption isn't as fast of various technologies that would help people stay in their homes and that they might even want as any of us would necessarily like. But to me, the first place to remedy that is give people a place where they have access to information about, and education. So education about how to use their technologies and information about what's safe and not safe to do online. And then give them time. This is all new. So the first iPhone was, the first smartphone was an iPhone. It was created in 2007. Uber started in March of 2009. Do you know how many people, adults in the country, have ever used a ride-sharing app, Uber or otherwise? The number is 15%. The number of people who have ordered their groceries online, 6%. So these are all very new. And the boomer demographic tends to be late adopters of technologies. So instead of getting people all these new things, doing all of this creation, I think our time would be a lot spent utilizing what's already out there and spending some more resource getting people educated on what's already out there. And the result is obviously going to be, there's going to be kind of the, just like with financials, there's going to be and with health, there's going to be the boomers that saved enough, that got ready, that thought about what they were going to need. There's going to be people that took advantage of learning more about how technology works, that are going to continue to feel a part of the world, a part of the community, are going to see pictures of their grandkids on Instagram and Facebook, and are going to live healthier and happier lives. And there's people that aren't, and that's kind of where we are. But I think that we would do well as a society to help people utilize what they have. So thank you very much.
Any questions?
When are they going to make an iPhone with letters big enough for boomers to read? Or type. Or type.
So I teach iPhone seminars that all of you are welcome to come to if you'd like, or you can check out our website at discoverengage.com. But the first thing we do at the seminars is we go to the settings and look at where you increase the size of the text and the size of the icons. And I found that for some people, the phone is still tough to use, and maybe they like the iPhone 6S or the tablet, but yeah, you can change it. And it's important, right, because AARP created kind of a simple phone and a simple tablet, and just like personal emergency response systems, nobody bought those. So instead, they have the iPhone that they can't read, but they're using it.
Have you gone to senior center to make a speech?
Yes.
Oh.
So I spend a lot of time at various senior centers. So certainly I am good friends with all the people at Avanitas, and then Little House is also a senior center. And yeah, I talk to people, and like I said, it's one of the places that I'm doing seminars. And right now they're just kind of one class seminars, and there's more information on our website. But we're hoping to turn those into kind of more formal courses where there's kind of 4 or 6 classes where you could really take somebody from texting and calling to being able to use their tech device quite well.
Cupertino?
Not yet, but take my card. I'll let you know.
Any other questions? What are the top 3 apps that you would recommend for what you're talking about here as far as the aging boomers go? Sure.
So I think the kind of biggest things are food, rides, and drugs. So for drugs, there's a company called PillPack. Like I said, they'll deliver drugs for your doors. For food, I think it really depends. You know, there's like I said, a whole range. So if you want groceries, Safeway.com. If you want more expensive groceries, there's Instacart. If you want, the more organic, I think people are saying no, Safeway. But you know, if you want, right. So I mean, what people are doing here and what people are doing in Iowa tend to be a little different. And so here I might say, Sprig. My wife and I really like Sprig. But a lot of people, especially in Sprig, food delivery, prepared meal delivery, but small portions. So anyway, the answer is food, take your pick, and then rides. I think Uber and Lyft both work. Sometimes I like Lyft better, and they both have recently added a Uber and a Lyft access. So they will come pick somebody up even if they are in a wheelchair or in need of further assistance otherwise.
Okay, any more questions? All right, let's give Ben a round of thanks.